Do you guys know what myopia is? Today we're going to discuss in detail about this eye disease, and with us today we have a very experienced doctor, Dr. Arjun. Dr. Arjun is a phaco surgeon and a pediatric ophthalmologist, and as well as a doctor who has been working in the field since 1999. Doctor, a very warm welcome, and let's just get into it right now. What is myopia? That's my first question.
Okay, thank you for having me over here. Myopia is actually a Greek word. It's a myop. So it means that it's a short-sighted. So actually, it's one of the form of refractive error where the distance object becomes blurry. It won't be clear.
So meaning short-sightedness.
Yes, exactly.
Then that's a very brief definition of myopia. My second question comes to, what are the causes of myopia?
So there is a multifactorial causes over there, not only one. So one is the genetic factors. So we can, if the parents both are myopic, then there are high chances of having children with a myopia. So this is the genetic factors over there. The second one is the environmental factors, where our way of life, how we work in a situation like that, also causes our eyes to be myopia. For example, lack of sunlight. It has been proved by the literature that the lack of sunlight also causes the eye to be a myopia or nearsightedness. That's why in Norway, where the 6 months there is a daytime and then there is a nighttime. So they have, over there, people have a high incidence of myopia, children's. So, and another one is the most common one is the lack of sleep. People over here work late night. So that's why it's recommended that the children should sleep 10 hours per night, per day, and the adults 8 hours. Should have a good sleep. Also, it affects the eye to become a myopia.
So sleep is very important. Getting out in the sun and spending time is also important. What could be some other symptoms of this disease, doctor?
Particularly, the most common symptom is the blurry vision. The patient or people will come, children will come, complain to their teacher or to their parents that they cannot see clearly, and you can also see the children squeezing their eyes to see the distant objects. That is also the one of the condition in which the myopia is not corrected. And other things are non-specific, but headache, eye pain, eye strain, like a migraine, which induces, and another one is the squinting. Is also caused by a myopia which is not corrected.
So when we see with our kids, maybe at school also, if the teacher notices the kids doing that squinting motion, maybe that's when they should come in for a checkup.
Yes, of course. They have to come to check they consult or book appointment for eye doctors.
Doctor, who is at risk of getting this disease?
Obviously children, because children are growing humans. So their eyes are also growing. So that's why they are the prone to have a myopia.
In your experience, who are the most affected people of myopia in Maldives?
Maldives also here children from 5 years to 20 years. So there are different types of myopia. One is the progressive simple myopia, where as the children grows up, the myopia, the numbers in the glasses also increases. So that way we can prevent, or we can still prevent the progression of the myopia. So minimize the progression also by doing good things about that.
After a patient is diagnosed with myopia, what are the preventative measures that the patient can take?
Okay, prevention of myopia, I'll give you 5 mantras or tricks over there. First of all, children should have 2 hours extracurricular activities to be exposed in the sunlight every day. Another one is should have good sleep, 10 hours sleep. And another most important nowadays is the screen time, excess screen time, and then screen time is near to the eyes. The children should not bring their books or a screen very near to the eyes. Simple suggestion is to follow 40, 20, 20, 20, 20 rules. Easy to remember. 40, 20, 20, 20, 20. What does that mean? You should put your screen or books 40 centimeters from your eyes. So easily you can, with the elbow's length, you can put it not near to that. And 20 means after every 20 minutes working in front of your screen, have a break by 20 seconds and look 20 feet away around the room or away in the windows like that. And the last 20 is blink 20 times to make your eye strain decrease.
Doctor, for sure, I have learned a lot from today's this little interview that we had, and I'm sure that everybody who's watching also learned a little bit something about myopia. This is the end of this episode. We'll see you again. Bye.